Well, let's speak to Conor D'Arcy, who is Head of Research and Policy, Money and Mental Health Policy Institute, and that is a charity founded by the consumer expert Martin Lewis. Thank you very much for joining us on BBC News, Mr. D'Arcy. I wonder if we could just start off first, please. What are you hearing from customers in terms of the panic? Because we're hearing about anxiety, we're hearing about despair. What are you hearing?
I think it's unfortunately a really common picture that we've been hearing about there. We did some polling earlier on in the summer asking people how the recent rises in the cost of living had affected their mental health, and 3 in 5 people, even back then, were saying it had a negative impact, and 1 in 5 said they'd already felt unable to cope. And I think what we find, unfortunately, is that often money and mental health make this really toxic cycle where, when your finances aren't good, that causes you stress. Maybe you don't sleep as well. Over time, that can build up to be basically a mental health problem. And then when your mental health isn't great, it makes it so much harder to say, do budgeting, to reach out for help from the places that can support you. And you end up in a more difficult position overall. So I think really, really tough times for lots of people at the moment.
Do you know, it's interesting you say that, because the National Energy Action have also been speaking about this, and they outright said that none of our little tips about coping are working anymore. So how should people be managing their mental health?
I think it's, I think firstly, if you are struggling financially, there are organizations out there who can help. If energy bills are concerned, as you mentioned, National Energy Action are a good place to turn to. More broadly for debts, people like Citizens Advice or Step Change can help you to kind of find a path out of it. I think talking to your providers as well, creditors who might be energy companies or banks or credit cards, because they can offer, options, reduced tariffs and packages that can make it that little bit easier. And I think if your mental health is struggling, your GP is obviously a good place to turn to, but there are also resources like Samaritans and Mind where people can get that support.
Do you know what? One of the hardest things is reaching out for help. Many people, you've talked through some of the places that you could go to, but many people don't actually realise that they need the help. It's the biggest step to take. Have you noticed how people are changing their financial behaviours at the moment, and what's likely to happen?
Yeah, I think unfortunately we've seen people cut back in all sorts of ways. I think there was some ONS research last week that found about 16 million people have already in some way cut back on food and essentials. And again, this is one, if you're having to make really difficult trade-offs, if you're not eating as much, it's not so much of a problem in the summer, but if you're not keeping your house warm, it obviously isn't gonna help your mental health. So I think that is why it's so important that it's not going to be the solution to everything, but firms being really proactive and getting in touch with all their customers to say, if you are struggling, please do get in touch with us. There are things that we can do. I think is so important to make it that bit easier for people to get in touch. I also think when, making sure that staff understand the impacts that mental health problems can have on you, to make sure they're properly trained, to really try and use the most of this window of opportunity we have now to sort of prevent the cost of living crisis from becoming a mental health crisis.
Conor, finally and very quickly, you just mentioned there that staff are trained. Are staff trained? Are there proper resources for mental health care out there?
I think in energy companies and banks and others, I think the picture varies, to be honest, and we work lots with firms to try and improve their offer. I think this is a tough time on staff as well when you're having to listen all the time to people in really difficult circumstances. So I think firms are able to help, and it is best for people to get in touch with their providers if they are struggling, but there's always room for improvement there. And I think more understanding of the way that money and mental health problems link up, I think is really important.
Conor D'Arcy, Head of Research and Policy at the Money and Mental Health Policy Institute. Thank you very much. Thank you. Just going to